Today I would like to talk to you about the sling procedure, how it's done and what is it used for. Hi, my name is Dr. Alexandra Dubinskaya. I'm a urogynecologist and sexual medicine specialist. First of all, stress urinary incontinence is a leakage of urine when we lose urine with physical activities like coughing, sneezing, laughing, lifting something heavy. So anything that increases your abdominal pressure. It's commonly happen due to the vaginal birth or chronic medical conditions like chronic cough, constipation, or connective tissue disorders. And one of the gold standards for treatment of stress urinary incontinence is sling. So there are two types of urethral sling. One is made out of synthetic material and another one made out of your own tissue. And there are definitely some pros and cons for using each of them. The sling that made out of your own tissue sounds great, but the problem with that is that in order to harvest your own tissue, we have to make a pretty large cut either on your belly or on your thigh. And we go down to the layer of fascia, the layer that supports your muscles, and we take a significant piece, about 10 centimeters long, that we take to create the natural sling, and then we close that incision on your stomach or on your leg. So essentially you're healing two parts of your body instead of one. So synthetic sling is made out of the same material that we've been used for years for hernia repairs, and it's a very small strip of that synthetic material. So one of the major benefits of having a synthetic mesh versus the autologous, the natural sling, is that it lasts longer, and also the recovery is significantly shorter. So when we do the surgery, we make a small incision in your vaginal canal and place the sling, and then we look inside of your bladder to make sure that's in the right spot. Surgery takes about half an hour to an hour, and you go home the same day. We do like to make sure that you can empty your bladder well. So you will be asked to pee in the recovery room, and we will measure how much you pee and how much is left in your bladder. If the sling is placed too tight, you might have some difficulties urinating. And if that happens, it's a very quick procedure to just loosen it up. Right after procedure, you can walk around, you can take a stairs, take a shower, go shopping, do whatever feels right to you, but just don't lift anything heavy or insert anything in the vagina. And depending on your surgeon and your particular situation, you can go back to your normal physical activities in about 4 to 6 weeks. A lot of patients might have a concern about the pain factor after the procedure. Well, for the first couple of days, you might feel some discomfort, but it's usually well controlled with Motrin and Tylenol. Your doctor will send you some narcotic pills, but majority of people don't even need to take it. Some women like to have a peri bottle at home, so when you pee after surgery, the urine might touch the area where you have your incision in the vagina and cause some discomfort. So by using a peri bottle, you're diluting the urine and providing more comfort. Some women ask me if they will feel the sling during sex. With correctly placed sling, you shouldn't feel it at all. Neither will your partner. One of the rare side effects that can happen is that the piece of that synthetic material protrudes through the vaginal tissue. That you just need to either remove that little piece of mesh, or you can just use vaginal estrogen and the vaginal tissue will grow over it. So if you are someone who is suffering with a urinary leakage with physical activities and have to avoid your favorite workout classes because of the urinary leakage, you might be a good candidate for the urethral sling. And if you tried the pelvic floor physical therapy, pessaries, and it's just not working for you and you really want to have a definitive solution, urethral sling is a great option. So talk to your urogynecologist to schedule the evaluation.